Hello, everyone. This is Dr. Taylor, and I'm giving you the fundamentals lecture on sensory alteration. Okay, so people learn about the environment from five experiences: their sight, hearing, smell, taste, and touch. When sensory function is altered, a person's ability to relate to and function within the environment changes drastically. As a nurse, you meet the needs of patients with existing sensory alteration and recognize patients most at risk for developing sensory problems. Your nursing care helps patients learn to alter their environment for improved safety. Scientific knowledge base. Sensory reception involves the stimulation of sensory nerves, fibers, and the transmission of impulses to higher centers within the brain. Normal sensation is composed of reception, which is stimulation of a receptor such as light, touch, or sound; perception, which is integration and interpretation of stimuli; and reaction. Only the most important stimuli will elicit a reaction. People feel and react to sensations when their nervous systems are intact. So, the perception or awareness depends on a region of the cerebral cortex in which specialized brain cells interpret the quality and nature of each sensory stimulus. Sensory experiences include reception, perception, and reaction. People react to stimuli that are most meaningful to them. Sensory alterations occur when people attempt to react to every stimulus within their environment or when stimuli are lacking. So, you receive a stimulus, um, any type of stimulus, like I said, such as light, touch, or sound. That's reception. How you perceive that stimuli is perception. So, how you perceive that, like for instance, let's say you touch something and it's hot. You perceiving that, oh, this is hot, is your integration and interpretation of that particular stimuli. And the reaction is the most important stimuli, which will elicit a reaction. For instance, when you touch it and you say hot, your reaction would be to withdraw your hand. Okay? And that is only if your nerve systems and things like that are pretty much intact. If your nerve systems aren't intact, then you will not react or you will not perceive it as any type of threat. For instance, that's the reason why people who have neuropathy, where they have the inability to feel certain stimuli, um, we may not tell them to run their bath water and check with their fingertips if they have neuropathy, or check with their toes if they have neuropathy, because they could burn themselves because the sensation will not, or how they perceive the stimuli is not adequate enough, and therefore they will not react. They will not pull their hand back in time. And patients have been known to burn themselves and go through changes. So you need to keep that kind of thing into uh, consideration when you're treating patients. So there's a case study, and the lady name is Miss Alicia, and she's a 73-year-old woman who is at the Senior Health Center for her routine 6-month checkup. She has been visiting the senior center on a regular basis for the past 8 years. Mrs. Alicia has lived alone since her husband died 1 year ago. She lives in a single story, 4-room home a few miles from the health center. Her son, Rico, lives 5 minutes away. Rico drives Mrs. Alicia to her visits. 6 months ago, Mrs. Alicia reported progressive hearing loss. Today, she reports having trouble seeing. So, what I want to ask class is, what assessments are needed for Mrs. Alicia? What questions would you ask her and her son as well? So, a physiological assessment to determine the cause of Mrs. Alicia's sensory impairment is critical. Other assessments would include a safety assessment of Mrs. Alicia's home. Questions that you may ask Mrs. Alicia are, and hey, you guys, I want you to analyze these case studies. And if you have to pause and listen to it because you're not in the particular position to ask me questions, please do pause so that you can take notes and have pretty good, sense of what is needed. So, um, questions that you may ask Mrs. Alicia are: one, when did the hearing loss start? What made you notice that you had difficulty hearing? Two, does anything make the hearing better or worse? Three, do you have ringing in your ears? Four, have you noticed any discharge from your ears? Five, how do you clean your ears? Six, do you wear hearing aids? Those questions, those 5 questions that I asked, um, are very pertinent because you want to know how long has she been dealing with this hearing loss? What made her have the difficulty in the hearing loss? You want to know, is she in an environment where her hearing loss is better or worse based on something? Like, did something damage her hearing? You know, does she have ringing in her ears, which is important? And all these type of things would tell you whether or not, what type of damage she may be having in her ears potentially. Do you notice discharge? That could be indicative of, you know, an infection. How do you clean your ears? Maybe she's sticking Q-tips up her ears and has damaged her eardrum or something. Um, do you wear hearing aids? So as far as her hearing aids, because we already said that she has reported having hearing loss progressively, we want to know, did she go and even try to do anything for it? Is she being followed by somebody about the hearing loss? Um, and cleaning her ears, like I said, damaging possibly her eardrums, um, things like maybe she has a cerumen or like earwax, which is earwax impaction in her ears. We want to know what's going on. So you try to think of as many things as you possibly can to ask Mrs. Alicia so that she um, can give you and you can gather as much information as possible. And then you'll have something to report to the physician and they can back up your assessment with, you know, maybe possible testing or something. Or she may have gotten it taken care of. And then at that time, you're looking at how she's reacting. Is she hearing you? Is she questioning you? What did you say? Is she doing, a lot of things? Is she saying that she has pain in her ear? You know, is she tilting to one side? You want to listen and look at all those type of things. So then, question number 7, you want to ask her when um when did the decreased vision start? What made you notice you have trouble seeing? Do you wear glasses or contacts? Have you had LASIK or other eye surgeries? Do you have headaches? And describe how these visual changes are affecting you or what type of changes in particular. Does she have floaters in her eyes, or she'll describe it to the best of her ability. So there are many types of sensory alterations. You have sensory deficits, sensory deprivation, and sensory overload. In the past, I know that upon testing individuals, we always would test on a person maybe having a specific symptom or reacting a certain way, and we would say that that was indicative of them having sensory deprivation or sensory overload. So, so I would pay close attention to what types of things that the people do when they have sensory deprivation and what type of things they do when they have sensory overload. So, sensory deficits basically means deficit in the normal function of sensory reception and perception. Okay, so you have a decrease, that's a deficit in the normal function of sensory, how you receive and how you perceive what um types of I guess you could say what type of uh alterations or what type of like if stimuli more or less is coming to you. So sensory deprivation is when you have inadequate quality or quantity of stimulation. I can give you a perfect example of sensory deprivation, and that would be like, I don't know how many of you have heard of failure to thrive infants um, who haven't been stimulated, they haven't been fed good, they haven't been held, they haven't, basically been getting the nurturing and things that they need. You know, they haven't been talked to, they haven't been caressed, they haven't been fed and can taste things. So basically, a lot of times when those infants are having sensory deprivation, it's almost like they just give up and they call them like failure to thrive. And you'll see it in charts as FTT, failure to thrive. And it's been I had a girlfriend and her sister used to take foster children in, and she had several kids throughout the years that would have failure to thrive. And I'm going to tell you, she would take those kids and them little infants and little toddlers and things, and she would love on them and feed them and play with them and groom them and show them all the care. And I'm telling you, they would start gaining weight. They would start having emotion and laughing. And then she would have to give them up. But it was like, I always admired that. And I always felt like that was a great uh, service that she was providing. And then you have another sensory, which is sensory overload and the reception of multiple sensory stimuli. So you just got noise coming, funny smells, all this stuff. And people tend to get real aggravated. And that's when you just got too much going on, too much sensory or stimuli going on. Bright lights, flashing lights. So that would be how you would look at that type of sensory alteration. So many factors influence basically the capacity to receive or perceive sensation. And that includes a developmental stage, how old somebody is, whether or not a person a person may be autistic. And most people know that that's somewhat of a social disease, but they don't receive um, you know, feeling and information. They're kind of some of them are very emotionalist. But yet a lot of them, depending on what level, if it's a mild level of autism, they would say that they would be like highly intelligent though. And I think about um it was a program that would come on TV, and this guy had autism and he was a physician. So just because someone has autism, it's more about the level of autism and what type, and that type of thing is really complex. That doesn't mean that that person um mentally is challenged. It's more like a social type of construct, in most cases. Okay. So inc- so medication can affect person, environment, like I said, pre-existing illnesses, smoking, and noise levels. A lot of those type of things can affect how a person perceives sensations. So a person could smoke and they may say that their taste buds are not as good. I've heard people say, I've smoked, and then when I stopped smoking, everything smelled different. The food tasted better, because it constricts your vessels, and maybe in your taste buds, you're not getting as much. So there could be a medication. I've known men to say that they were on certain blood pressure medications, and it took away their sexual arousal and their ability to, you know, be that way. So that's what I'm saying. The perception and how they receive that there's a lot of different things. Um, Diabetes, people with diabetes, if it's uncontrolled, a lot of times they may tend to have problems with neuropathy, where they don't feel at the tip of, their distal parts of their body, like their fingertips and their toes and feet and that type of thing because of the circulation not being as good. So in your nursing experience, you care for patients with like a variety of problems such as sensory deficit, sensory deprivation, and sensory overload. When patients have more than one sensory alteration, which they could be blind and they could be hard of hearing, their ability to function and relate with the environment becomes very, very impaired. Okay? Um, a sensory deficit occurs when a problem with sensory reception or perception exists. Patients are not able to receive certain stimuli like light and sound. Stimuli are distorted. I remember before my mom passed, she started having problems with her hearing. And I'm going to tell you, that changes a person's personality. Um, Sometimes when a person can't hear very well, and if they're not reading your lips or whatever when you're talking to them, and they start to lose their hearing, um, it can mess with their balance. Um, they may have incidences of falling. Also, um, a lot of times when patients are really, really proud, they'll try to act like they can hear you. For whatever reason, I don't know why they do that, but they really can't really hear you that well. And sometimes they'll do things like you'll say something, and I know she would do stuff like, yeah, uh-huh, yeah, like that. And I will be knowing that, okay, she doesn't hear me really well. Why can't she just say it? But like I said, sometimes people are so proud that don't, they try their biggest not to let on. That can be very dangerous if a person is not hearing adequately, you know? So, um, sometimes people can have blurred vision from cataracts in their eyes and abnormal taste sensation from xerostomia, a sudden sensory loss caused by injury or as a side effect. The medication causes fear, anger, and feelings of helplessness. Also, what I want you guys to do is I want you to start if it's like something and you don't know what it means, like I'm gonna give you guys uh uh like I had made the statement, um abnormal taste sensation from xerostomia, and that's spelled Xerostomia. I want you to look it up. The next time I meet with you guys, I may just randomly ask somebody what it is. And the reason why I'll do that every now and then is because once you look something up, you probably won't forget it rather than me just telling you every single thing. Of course, there are going to be a lot of things that I will offer and tell you. So, um, like I said, side effects of medication causes uh, fear, anger, and feelings of helplessness. And that is the reason why a lot of times certain patients, they'll try to disguise whatever type of sensory loss that they have. And it's your job as a nurse to look at various signs. So when a deficit is chronic, which means it's been going on for a while, or it develops gradually, a patient learns to rely on unaffected senses. So, like, oh, I can't see that good, but I can smell real good and I can hear real good. You know what I'm saying? So some senses even become more acute to compensate for an alteration. Sensory deprivation occurs when inadequate quality or quantity of stimuli impairs how they perceive it, perception. It has different causes, such as reduced sensory input, which is hearing loss, and so that may lead to confusion and a restricted environment, which means they'll be on bed rest all the time. Sensory deprivation sometimes produces cognitive changes, produces cognitive meaning, how they uh, learn and look and gather, information, and how they understand information, such as the inability to solve problems, poor task performance, and disorientation. So a person can have lose their senses and they can go through all those type of changes. They all of a sudden can't, solve problems, poor tasks. They're not doing things the way they used to do them, and they're disoriented, and all of that type of stuff can come from people losing their vision or losing their hearing. You may say, well, grandma can't cook like she used to. Well, maybe she's going through a few things. Maybe she's not seeing as good as she used to. And instead of using uh, um, maybe some cooking powder, she put some regular flour in there instead, or some sugar in this instead of this, or she did something different from what she used to do, and they be confused, they be forgetting things, and all of that. All of that comes with sensory deprivation. When a person receives multiple sensory stimuli, the brain has difficulty distinguishing the stimuli. So now we're talking about sensory overload. You know, a person with sensory overload no longer perceives the environment in a way that makes sense. Overload prevents a meaningful response to stimuli. As a result, thoughts race through a person, uh, attention moves in many directions, and they're restless or agitated. Sensory overload causes a state similar to that of sensory deprivation. Patients of all ages who are acutely ill easily develop sensory overload in their environment. You got people coming in and out, doing this and that, taking blood. Oh, let me take your vital signs. Oh, let me turn you. Oh, clicking the light on when you're trying to sleep. Oh, and they're just confused. And I've had patients where they forget where they are, man, before, you know. So constant reorientation. You got to do person, place, you know, time. Um, you gotta, you know, they oriented times three and four, or they oriented the person, place, and time. You gotta do that all the time. And a lot of good ways to see um is to just have conversation with a person. I had an incident where I knew that this lady was, confused, but she would come and out, in and out of confusion, you know, and there would be times where she would be really lucid and times when she wouldn't be, because like when I take my students out to clinical, I go and I check and I meet with their patients on my own, and I talk to these patients because I want to see what's going on and if they're assessing it well. And I had one of my favorite students, and he brilliant nurse, and I really liked him a lot. He took a liking to this one particular patient, and I asked him. I said, so I see here that you were writing your notes, and we would be practicing. And I said, you put that she was oriented um times three, so person, place, and time, and um and I said, no, I said she's oriented times one. She knows who she is, and then he says, what? And he says, no, she's not. She knows what's going on. I said, on a certain level she kind of knows what's going on. Like, when you talk to her, she talks with sense and everything. And I said, ask her, like, where she is. Just talk to her about where she is, and ask her what's going on. And so we're here in Tampa, and we go in together and talk to the lady, and the lady told him that it was like 1970 something, and that she was in Shands Hospital in Gainesville or something, and he was astounded. And I told him, I said, there are ways, um, without you particularly telling the patient what is up, but you can get information from the patient and know so that you're charting, accurately, uh, about that particular patient. It was really quite funny. So, nursing knowledge base sensory alterations are common in older adults. In the United States, between 25% and 40% of people over the age of 65 have a hearing impairment. The incidence increases with age. Approximately 90% of adults older than 80 years have hearing loss. So that is a big, you know, uh, statistic for you to look at. 285 million people are visually impaired worldwide, and 39 million are blind. Old people are at risk of several eye diseases, including age related macular degeneration, cataracts, and glaucoma. Now, if you don't know what macular degeneration is, which you know what the macula is in your eye, and so, and you know what degeneration means, but if you don't know what cataracts are, cataracts is that little coating over your eye that people just kind of naturally develop, and you have, as you get older, and they just go in and they just remove the cataract, and that helps it's just like a coating over the eye. I don't know if you've ever seen old people and it look like they have a little film, like over their pupil, you know, and their iris. That's what a cataract. And it's nothing that they've done. It's just a age related thing with time. And glaucoma is like an optic pressure, in the eye. And they can treat that with drops, and um they can go in and put stents in and relieve the pressure, it's outpatient. So that's not a problem. A loss of sensory input can cause feelings of grief, anger, depression, and loss of self-esteem. And I really just, and I've known people that have had sensory deficits and were really nice people. And then as they got older, and then maybe they developed a sensory deficit of some sort, and maybe not even older, maybe they had an accident of some sort and had a sensory deficit, and they would be mean as a rattlesnake. So I always keep that in mind, that sometimes it's not that the people want to be that way. It's just that generally, when a person is ill or they're experiencing something health wise, they are not their self. So I'm going to need for you guys to be compassionate on that level. So it is estimated that 1 in 5 Americans will be over the age of 65 by 2050. Therefore, the incidence of age related decline in sensory function will continue to increase. As a nurse, stay informed of new healthcare and nursing knowledge as it pertains to the older adult population and the effects of diverse sensory change. Self-esteem disturbances can lead to social isolation. So they start feeling bad about themselves. Then they start um, not being around people because they feel bad about themselves. So then they got sensory deprivation. A lot of times, have you ever known somebody that lived their life totally reclusive? And then when you encourage them to go out and then they're around people, they tend to get more of a pep in their step because they're getting that socialization. So as a nurse, stay informed of new healthcare and nursing knowledge, and as it pertains especially to the older adult population and the effects of diverse sensory changes. Vision and hearing alterations often have profound consequences for function and quality of life of older adults. A loss of sensory input often creates feelings of grief, anger, depression, and loss of self esteem. Self esteem disturbances frequently lead to social isolation and withdrawal from social activities. Your knowledge about the effects of sensory loss on your patients allows you to promote their healthy aging. Assess how a sensory impairment influences a patient's self concept, mood, and ability to communicate and function in the everyday world. So, patient education can provide older adults with the necessary skills to cope with sensory alterations. Um, so, with that patient education, prevention and treatment of diseases affecting vision and hearing, available social services, or any type of assistive devices, and the need for annual physical examinations help provide the older patient with better coping abilities and health maintenance. So you need to manage patients with sensory alterations, challenges, to apply nursing research and information from practice to help patients participate in their environment, remain socially interactive, and continue to be productive. In addition, your application of critical thinking principles helps you promote patient sensory function and also protect them from possible injury as a result. So all of that is like very, very important. You educating the older population and promoting health and helping them do the things that they need to do. So another case study, Peter Morris, a 33-year-old nursing student assigned to the senior center, is learning to conduct assessments and develop a health promotion plans for patients. For the past month, oh, Peter has been attending his clinical rotation and he's participating in teaching health promotion activities. He is enjoying this rotation because he is learning more about geriatric patients and is finding that they are very independent and capable of having productive lifestyle. Peter, what sort of health promotion activities do you think Peter will consider for Mrs. Alicia? Do you remember Miss Alicia? Miss Alicia, the lady, she had the she was accompanied by widow for about a year. I just talked about her. She was accompanied by her son, and she was having hearing and vision problems. Remember that? So you need to think about what type of activities Peter will consider referring Miss Alicia for evaluation of her vision and hearing. Peter will conduct a great deal of teaching with Mrs. Alicia. Okay? So, critical thinking. You have to have the knowledge. You got to know your pathophysiology. You got to know how to communicate with patients, and you got to know your pharmacology. There is nothing wrong with you looking up meds. Meds are constantly changing, you guys. And so you're going to constantly have to look up medicines and see what their actions are and find out what um they do. Never give something that you know absolutely nothing about. Even if you have to pick up um, the phone and call the pharmacist and ask the pharmacist, what is this medicine about? But most places on the computers, they have areas which will tell you about contraindications and what the action is and what this medicine is being used for and what type of nursing implications or things that you can do to assist in um, the patient and everything on how uh, to know what they need to do when taking a particular medication. And then you need to learn and be able to communicate with the patient the proper way as well. So you will apply elements of critical thinking whenever you perform the nursing process, the adult, and consider the scientific knowledge you have learned, your experience, which will get better the more you practice critical thinking attitudes and standards to ensure an individualized patient care. And you'll keep hearing them say, individualized, individualized, because a lot of times you'll have a standard care plan or standard concept map, and it'll say do X, Y, and Z, do X, Y, and Z. But you have to know about your patient and you have to tweak it a little bit to fit your patient because not all people are the same. All people are different. And therefore, I mean, it may be something that's pretty standard, along the lines, and everything like that, but you need to make sure that you know that oh, for this particular patient, she's allergic to this. So we generally give the patients this, but she's allergic. Or, well, she has neuropathy here, so I can't make her do this, but instead I'll make her do this instead. So that's what I mean when I say individualized patient care. And as you apply the nursing process for patients with sensory alterations, make sure you anticipate the kind of information necessary to form good clinical judgment. A combination of past patient care, experiences, and the application of scientific and nursing knowledge helps you develop an individualized plan of care for that particular patient. So, knowing the pathophysiology, um, changes of a sensory organ disorders also help to anticipate how sensory changes could possibly affect the patient. So, depending on the patient's problem, you use your knowledge of communication principles to see the best communication method. You also need to have a working knowledge of pharmacology because of a variety of medications affect sensory function. Previous personal or clinical experience with sensory changes help you anticipate a patient's care needs. Critical thinking attitudes lead you to become a more disciplined thinker. Creativity is often necessary to find the right solutions for your patient's problem. For example, living in a non stimulating home environment can cause sensory deprivation. Work with your patient to develop changes in the environment to improve the quality of stimulation and reduce the patient's risk for injury. Curiosity applies when a patient shows unexplained behavioral change. Asking why and being curious, it helps you assess a less obvious sensory problem. So you have to be upfront and you have to try your best, you know, and even if you're working in a hospital setting, you may be able to convey that information to the case manager who will be able to convey information to a home care nurse. So then you have to have standards, ethical as well as professional. An important ethical standard to follow when assisting patients with um, alterations is to make sure that you preserve their autonomy. So you want your patient to be as independent within reason as possible. For a patient to regain independence, do not override autonomy with the principle of beneficence. For instance, doing what benefits the patient. The Joint Commission, along with the American with Disability Acts, require healthcare institutions to address the needs of patients with sensory alterations and provide interpretation services as necessary to establish understanding and maintain confidentiality. Evidence-based standards of care and practice, such as those from the American Academy of Ophthalmology and the American Speech Language Hearing Association, provides criteria for screening sensory problems and establishing standards for competent, safe, and effective care practice. So basically, be professional and know what you need to do, where you need to go. So, the nursing process assessment. You need to conduct a sensory assessment for any patient at risk for sensory alteration. So, these patients include those living in a more confined environment, such as a nursing home. Always remain alert for any behavioral changes common to sensory deprivation. Okay? Like, be aware that patients can have a combination of a sensory deficit and they can have a little overload simultaneously. For example, you got a child in a pediatric intensive care unit, and that child experiences sensory deficit because the room has no windows, but also it experiences sensory overload from noise that occurs around the clock at the nursing station. So remember, I was telling you they can be experiencing both. Older adults considerations or at high risk group because of a normal physiological change associated with aging. However, be careful not to automatically assume that a patient's sensory problem is related to advanced age. You got to make sure you basically investigate. So you would include an assessment of the nature and characteristic of sensory alterations in your nursing history. Assessment categories may include the type and extent of sensory impairment, the onset and duration of symptoms, and whether there are factors that aggravate, or relieve symptoms. Learn about a patient's perception of a sensory loss to find out how his or her quality of life has been influenced. You got to know how a person is perceiving. Some people go down hard. They fight it to the end. And then some people, they have come to like an acceptance and they're like, okay, I'm living with this sensory deprivation and I just want the best quality of life that I can have. So what do I need to try to have best quality of life? Okay. So the amount of quality of contact with family members or friends a lot of times determines whether a patient with sensory alteration becomes isolated. Hopefully they have people around them in their corner because they'll be truthful with you. They'll tell you what's going on. So a patient's functional ability incorporates their ADLs, which is their activity of daily living. So the ability to do grooming, uh, 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 bathing, dressing, and mainly toileting. And their instrumental activities of daily living, which is IADLs, instrumental activities of daily living is grocery shopping, writing a check, using a phone. Okay, those are examples. There may be, and there are usually, I have seen test questions that have things about the difference between the ADL and the IADL. And I've even seen advanced activities of daily living, like, oh, I'm going to the club. So, but I'm just saying for your learning, you probably don't need that. You don't. If a sensory alteration impairs the patient's functional ability, planning for discharge from a healthcare setting and providing resources within the home become necessary. So, because some patients are unaware of or unwilling to discuss behavioral changes, family and friends are often the best resources when determining if sensory changes have altered the patient's behavior. Remember, I said there are some patients that fight it and they will lie to you, basically. Assess the daily routine that patients follow in maintaining sensory function. The information determines a patient's need for education or referral to appropriate sources. Ensure the patient's environment is free from any type of hazard. A thorough home assessment helps you provide options for ways to make the home safe. Assess for any factors in a healthcare setting that will be dangerous to the patient, such as clutter or obstacles. Now, a lot of home care nurses will go in, or physical therapists will go in, and they'll see different things that could potentially, like, oh, they got this slippery rug that they could slip on here. They got this, plugged up here, and they could trip over this wire. They got all the items way up at the top and almost slip trying to get it up, you know. But so what you trying to do, oh, they need side rails in their shower, you know, that would be the occupational therapist that would help with that. So you trying to be really, really, really safe and try to do the assessment. So meaningful stimuli reduce the incidence of sensory deprivation. A patient becomes disoriented in a barren environment. So that gives few signals for normal sensory perception. Meaningful stimuli influence the patient's alertness and the ability to participate in self-care. What are some examples of meaningful stimuli? What do you think some examples? You know, in the home, check for the use of bright colors, comfortable furnishings, adequate lighting. Make sure it's good ventilation, it's not stuffy. And make sure the surroundings are relatively clean. Also observe for presence of pets, family pictures, television, a clock, a calendar. Note if patients have roommates, visitors, or any personal items such as pictures. Those are considered meaningful stimuli. Meaningful. Excessive environmental stimuli cause sensory overload. Your responsibility as a nurse is to identify and reduce or eliminate excessive stimuli. Assess if a patient has trouble speaking, understanding, reading, or writing to understand the quality of their communication. Next, ask the patient which communication method they prefer. Patients with existing sensory deficits often develop another way or alternative ways of communicating. So, patients with known or suspected sensory deficits resulting from visual and or hearing losses, spinal cord injuries, or peripheral neuropathies require complete and detailed sensory examination. Assessing the extent of sensory loss allows you to focus your review on behaviors of sensory deficit. So when conducting an assessment review a patient's express needs, what they tell you, many patients have a definite plan as to how they want their care delivered. And then some expect you to provide equipment for them so they can properly care for their sensory aids, eyeglasses, or hearing aids. Asking patients what they expect helps you to initiate effective strategies and provide access to resources. So it's nothing wrong because some people get the idea wrong, some people get it right. Some people want some things, you can tell them what you can do for them. You can tell them, well, I can't do it, but I can refer you to this person that can do this. Eliciting patient values and preferences, and people live differently, you guys. So don't be overly judgmental as long as it's something that won't potentially hurt them, you know. Uh, and don't put beneficence over providing them the care, you know, uh, like listening to what they need or like you trying to change their value system or how they're living their life like to meet your standards because their standards may be different standards. The only thing that you need to go by is safe and improving and encouraging autonomy in their lives. Okay? So getting back to the case study, Mrs. Alicia reports that at her last visit to the ophthalmologist, she was told she had a cataract. Remember, I told you guys what a cataract was. And remember, I said that cloudy film over the eyes, that may be why she can't see that well. Peter learns that Hispanic Latino individuals in the United States have higher rates of visual impairment and blindness compared with the members of other ethnic groups. Visual field loss has a negative impact on health related quality of life, such as driving, distance and peripheral vision activities, and a sense of independence. So Peter, he, the nurse, uses this information to develop a culturally competent plan that focuses on Mrs. Alicia's visual impairment. So, what are some possible nursing assessment steps for Peter to use with Mrs. Alicia? Now, you can stop now and you could try to come up with some of your own. You could put it on pause. So, after putting it on pause, I'm going to tell you Some nursing assessment steps for Miss Alicia may include review with Mrs. Alicia at each visit the importance of early intervention through regular vision examinations. You might provide information about side effects of visual impairment and encourage the use of visual and adaptive devices when possible. Ask Mrs. Alicia how she is coping with visual alterations. What is she doing? Ask Mrs. Alicia about her social networks and supportive relationships. You know she had the son, but does she have any friends? Does she go to church? You know what I'm saying? Assess for changes in mood. Ask her if she's feeling depressed. Determine if Mrs. Alicia has experienced new limitations of activities of daily living or a change in participation in leisure activities. So sometimes you may not want to say the word depressed. You may just ask her, are you feeling kind of down or low? Because sometimes people feel like there's a stigma around the word depressed. But, you know, you have to find that soft spot, that sweet spot. But change and participation in activities is a real thing to look at and to question about when a person has a sensory deficit and when a person has pain. Because if a person is not doing or experiencing life how they previously do, they probably won't be doing a lot of the activities that they're known to do. You know, when my dad was having that numbness in his leg and the back pain before he had got his back surgery, he stopped fishing. So that let me know he's really having problems with his back because fishing was something that he loved to do. So assessing a person's activity level when a person stops doing things that they normally do, that you know they love to do, and it's something that's not detrimental to them, shoot, you better go look and see that there is a problem there. And refer her to community resources and stuff. Refer her to that. So here's a quiz, you guys. An elderly patient who lives in an adult assisted living facility mentions that he is experiencing hearing and vision changes. During your assessment, you associate this type of sensory deprivation with A, a stable affect, B, a altered perception, C, improved task completion, D, increased need for social interaction. The answer is B, altered perception. And think about it. Remember, that was one of the main things when we talk about sensory is them having an altered perception. And they did not say anything about him not having a social interaction. So don't just assume that. Go by what we taught you. Go by what you know to be true. Okay, so the diagnosis part. Here is a review of all the type of um diagnosis you could use for a person with any type of sensory alteration. Anxiety, fear, impaired physical mobility, hopelessness, risk for injury, deficient knowledge, impaired social interaction, bathing, self-care deficits, risk for fall. All of them are type. They're related to a person having a sensory deprivation. They could experience all that. So if you run into a patient and a patient is having that, that will be a diagnosis for them. So after the session, review all available data and look critically for patterns and and defining characteristics that suggest a health problem related to sensory alterations. And then validate your findings to ensure accuracy of the whatever particular diagnosis that you choose. Example of a nursing diagnosis that applies to a patient with sensory alterations, of course, are shown on this slide. Next, determine the factor that likely causes the patient's health problem, and the etiology or the related to factor of a nursing diagnosis needs to be accurate to ensure that you select appropriate interventions, which are things that you're going to do for them. So just think about that. So, Miss Alicia's diagnosis ended up being risk for injury. Miss Alicia states, I'm having difficulty reading and moving around the house. I cannot judge the steps clearly. I have difficulty judging distances between objects, which is worse at night. You see how she's a risk for injury. You see, you guys, how you pick that risk for injury right off of this slide. Okay. Results, and that was related to her vision being impaired, right? Results of a home hazard assessment show that Mrs. Alicia's home has dim lighting, stairs that don't have handrails on them, and numerous throw rugs on the floor. See, and that's how Peter, the nurse, came up with risk for injury. So then you're going to plan, because we're doing our nursing diagnosis, the goals and outcomes. Patients with sensory alterations have many needs. The plan of care you develop depends on your assessment of the patient's sensory perception and acceptance of the sensory alteration and how well he or she has adjusted to the law. So you can do a concept map and a sample care plan with the risk for injury. You can look that up in the book. So doing planning, develop and individualize. Everything has to be individualized, you guys. Plan occur for each nursing diagnosis. So for that particular patient and she had risk for injury. Partner with your patient right here out of goals and outcome. Partner with your patient to develop a realistic plan. Make them part of it because if you make them part of it, they will be more prone to do the things that are a suggestion, and you're trying to keep her safe because she's at risk for that's your gonna be your goal. Keep her free from falls, to keep her safe in her home environment. So incorporate what you know about the patient's sensory problems and the extent to which he or she can maintain or improve sensory function. So any goals that you have, they need in the outcomes, they need to be realistic and they need to be measurable. When we say realistic, you're not gonna say that she's gonna get 100% of her vision back in 30 days or whatever. She may not never get her full vision back, but you can make the area of safety. So it's safe. So you'll say patient will be without any falls and maintain environment free of clutter, and you're going to do interventions or environment well lit, or you know what I'm saying, different things like that. Or she's going to get that surgery, and that's more of a long term, maybe to remove the cataracts. She's going to always have her glasses at the bedside, or maybe several glasses. It just depends on what's realistic for that patient. Those are the intervention that's going to learn to lead to the particular outcome. So you're planning for them things. So you review all available resources and stuff for that patient. So you can develop a plan of care. They got to be realistic for that particular, and you can make a short-term goal and a long-term goal. I always tell people to do little short-term to the ultimate. You could do both to the ultimate long term. But if you do a bunch of little short term goals, that patient, and if they're realistic, that patient may tend to reach that goal, and that would increase their confidence, and they will continue to do what they need to do to make your realistic long term goal. So you're going to set a start date and an end, date. In 2 weeks, in 1 week, she's gonna do this, she's gonna do that. And they're gonna be this, we're gonna do that. That's how you would do it. And you could always go back and tweak it if it's not working. You can add different interventions. You can always, which means you'll be doing different things to assist her, or you can give her more time because she's made some progress, because you're always constantly evaluating what you try to do for that particular patient. And so generally what you'll do is you'll rank that diagnosis in order of importance. You know, you know, you got to, whatever is the most important, you know, and review all the resources, and make sure you get that son who's 5 minutes away to help, you know. Maybe you can refer her to the American Foundation for the Blind, American Red Cross, the Lions Club, any place that you need to do to help that patient meet their needs at home. So, Miss Alicia's home environment is safe and free of hazards within 4 weeks. So that could be doable, right? In 4 weeks. Remember I said measurable, which is the 4 weeks, and it's realistic. You're not gonna say her home is, because who's gonna clean it up? Who's gonna put the new lighting in? Who's gonna make sure the throw rugs and all? She can't do it because she can't hardly see that good. So what expected outcomes for Miss Alicia? Miss Alicia will report an increased sense of home safety and independence within 2 weeks. So she's telling you this. Mrs. Alicia and her son will make recommended changes in the home environment within 4 weeks. So do you guys get where I'm going? And then you implement everything. The most effective interventions enable patients with sensory deprivation to function safely with existing deficits and continue a normal lifestyle. Preventable blindness is a worldwide health issue that begins with children and requires appropriate screening. The most common visual problem during childhood is a refractive error, such as like nearsightedness. The nurse's role is one of detection, education, and referral. That's what you do. You detect there's a problem, you educate the family members or the child, their parent or the person, and then you refer. Because aging is associated with degenerative changes in the ear, patients need to have hearing screenings at least every decade through age 50 and every 3 years thereafter. So every 10 years, and then every 3 years after that, once they become 50 years old. Children and adults are vulnerable to uh, eye injuries. Patients with sensory deficits often requires use of Assistive aid. Patients who wear corrective lenses, eyeglasses, or hearing aids need to keep them accessible, functional, and clean. My son grew up, he was a glasses guy. And I am so proud that I remember when he was going through his teenage years because he talked me to get him contact lenses because he was playing football as well. uh, and he would have I would go buy money and get the prescription goggles and stuff for him to wear. And he was telling me, he was like, Mom, these goggles are fogging up. I don't like them. These goggles. Can I try contacts? Can I try contact lenses? So I take him over there. It was the summer before because he was practicing and he was getting ready to go into high school and they had this little summer camp. So I took him and I got him a prescription for contacts and it took him about 2 weeks to be able to put them contacts. I would hear him in the morning like, oh my goodness, because he was getting so frustrated. And I was thinking to myself, he ain't gonna be able to do this. This dude ain't gonna be able to do this. He ain't gonna be able to do it. But I just stayed out his way. And then one day I looked up and I didn't hear that no more in the morning. And he had went back to the school and it was his freshman year in high school and he had grew about 6 inches. He was tall and he had been playing football and he found out that he was a key scholar because he had aced they have that FCAT test or whatever. And when he was in 8th grade, because that was when we moved here in Florida. And so he got really popular with the girls and he was smart and he was playing and he had his little contacts. Mama didn't like it too much because I had to go out and buy all new clothes for him and everything because he had grew so. But to make a long story short, he stayed free of any type of infection or anything. He has never had an infection. He at least did it right in his eyes the whole time that he has had contact lenses. He's never had an infection, not one time. So that was a great thing to keep them functional and clean. Uh, and then um, if you look in your textbook, make sure that you know about the care of hearing aids, how to make a note of this, because this is just like a lecture about the care of hearing aids. Because I have seen on exams in the past and saying that I didn't make any of these exams this semester because I came in, I got hired before, after the semester and everything was on its way. Uh, I just want to let you know that I think that that's something important. Patients often need encouragement and support to even explore assistive devices. You help patients make their environments more stimulating by making adaptations, to assist them with those type of assistive aids. So you screen, you prevent, you be safe, use assistive aid, promote meaningful stimuli, establishing safe environments, and you make sure that you always communicate with people. You communicate with the family, you communicate with the friends, make sure that everybody knows everything that they're doing, you know, for it. So acute care, orientation to the environment, safety measures, communication, and controlling sensory stimuli. If you was in an acute care environment, think how you would feel if you had alterations in hearing and vision. You might want to conduct an X. You might want to see and conduct an exercise with each other. Collect some old eyeglasses or sunglasses. Place tape or petroleum jelly over the glasses to represent glaucoma. So take some glasses, get some scotch tape, or either put some petroleum jelly over your glass. And what that's going to do is represent glaucoma and partial vision, total blindness, or other visual impairment. Stuffed cotton, a cotton ball in the area. And this may give you an idea of the ability to experience what a patient would experience. So do that if you wear glasses, or you could just uh, you know, put some cotton balls in your ears for a little bit. So completely, so you got to make sure, and then what that does is that just gives you a sense of what it is like, you know. So completely orient patients with sensory impairment. Always keep your name tag visible. Always address the patient by the name that they choose. Always explain their location and frequently include the time and date when you are conversing. So you're always orienting them. If they got serious visual impairment, you need to make them feel comfortable knowing what boundaries are in their environment. They need to walk through a room and feel the walls and establish a sense of direction. You need to place whatever necessary objects that they need, like if they got a car light, if they got a PCA button, glasses, water, facial tissue in front of the patients to prevent them from falling, from reaching. And then you just ask them how to arrange the objects so that if they ambulate or walk, as that is, it can be easier. And then if you have a patient that has sudden or acute visual impairments, you help them walk. So you will stand on the patient's dominant, whatever side is stronger, and the patient will grasp your elbow or upper arm, and you then walk one half step ahead. So always stand on the patient's dominant side, the strongest side, and you would, or whatever side, if something was injured, you would get on the other side, and you slightly walk one half step ahead, and their shoulders directly behind your shoulder, and relax and walk at a comfortable pace, and just kind of guide them. Do not leave a patient with visual impairment alone in an unfamiliar area if the patient has unstable mobility, or if they use a gait with belt during walking or something like that. And when you communicate with your patient, always actively listen and provide adequate time for patients with sensory deficits to respond. Note that most effective way to communicate with the uh, patient in the patient's medical record. So when you look in a medical record, it should tell you about the most effective way to communicate with them. Reduce sensory overload by organizing the plan of care and to control for excessive stimuli. Combine activities such as dressing changes, bathing, and vital sign assessments in one visit. And that prevents a patient from becoming over fatigued. fatigued or overwhelmed. And then you're going to try to control extraneous noise, so outside noise, in and around a patient's room, such as television volume and visitors. In addition, you can control excess stimuli. Try to introduce meaningful stimulation that makes the environment pleasing and comfortable. Now, earlier, I did tell you guys what was considered meaningful. Okay. Restorative and continuing care. After patients have experienced the sensory loss, they need to just continue a normal lifestyle. Many of the interventions previously discussed that we talked about earlier under health promotion are adaptable for the home setting. Patients with sensory impairments are often able to continue independent self care activities. For meals, you can arrange food on a plate and put their condiments, their salad, or drinks around the plate according to numbers on the face of a clock, for instance. The patient becomes oriented to the items after the family member explains where the location of each item is, for instance. So patients need help to arrange self-care items such as clothing, hygiene, food supplies, and utensils in a consistent, which means you're going to try to place things in that area all the time, location, to continue managing daily activities. A patient with visual impairments also needs to reach the bathroom safely. Safety boards need to be installed near the toilet. A board that is different color from the wall is usually easier for them to see. If tactile senses is decreased, people need to have their ability to touch tactile. People need to have zippers or Velcro strips, pullover sweaters or blouses, and elastic waist or easier for the patient to use. Some patients also need assistance with basic grooming, such as brushing, combing, shaving, and shampooing hair. And that just kind of depends on how bad it is. Make referrals to any people that you need to collaborate with, uh, like physical therapy or occupational therapy, to ensure that patients are able to function at an optimal level. Interacting with others become a burden for many patients with vision and hearing impairment. A patient with a hearing loss sometimes becomes embarrassed and exhausted after asking people to continuously repeat what they say. Introduce therapies to reduce loneliness, particularly in older adults. And I wanted to mention, I don't know how many of y'all people saw Ray, with Jamie Foxx and Ray Charles, who was the blues singers. For those of y'all who are like very, very young, uh, it was his life story. And I was thinking about how they were saying that you can do things to make life easier. And he was a little boy when he went blind. And he they actually had where they sold a number on his sock, and he knew which socks to put on with each outfit. Like, oh, one is black, two is brown, three is blue. Like he knew what color by the number, so that way he could dress appropriate because he could feel the number on the sock. And I thought that was real interesting. So, yeah, I mean, it was like real goody stuff. So, what interventions would apply to these rationales? Basically, sensitivity to glare increases because of clouding of the lens. Light intensity needs to be 3 times as powerful for older adults to produce the same visual acuity or ability to see sharpness as for younger people. Removal of trip hazards prevents falls and promotes a safe environment. And what fall prevention or interventions would Peter choose? Remember, we still talking uh, about our patient. These interventions apply to the rationale. Recommend that Rico uh, install a non-glare work surface in the kitchen area. So Miss Ali, that's Mrs. Alicia's son, um, recommend that Rico install incandescent lights in the home and help Rico identify potential trip hazards such as throw rugs and suggest that they be modified or removed. For fall prevention, teach Rico methods to improve environment safety such as installation of rails along stairs, securing carpeting, removal of throw rugs, and painting of stairs. Suggest that Rico place a non-slip surface, such as a non-skid mat in the bathtub and shower. So these are the things, and you see, it don't have to be like super duper sophisticated if you stay on track. Because if you stay on track, all you basically are doing is providing that safety because she was a risk for injury. That's the diagnosis because of her vision. What nursing actions would be appropriate for Peter to take to evaluate Miss Alicia's situation? So now he's evaluating. Ask Mrs. Alicia at her next visit if she has experienced any trips or falls since modifications were made. Ask Rico if his mother's having any difficulty moving through her home and conduct a home visit and reassess the home environment. So we're going to just say that we achieved our outcomes with Mrs. Alicia and and Rico, and that there have been no falls or accidents. And if Mrs. Alicia is able to move throughout her home, uh, she's able to do it without difficulty. If you ran into difficulty, you would have had to go tweak your interventions, which are the things that you did to try to make her situation better, for her to be safe overall, and for her, not to get injured. Okay? So the evaluation, we just went through a full care plan, you guys, and talked about sensory. Patient care, the nature of a patient's sensory alterations influences how you evaluate the outcome of care, which means how severe and what you did. How did you do a lot of the alterations? When a patient does not achieve expected outcomes, what did I just say? You need to change your interventions or alter the patient's environment. And then the patient's expectations are important. Ask the patient if expectations have been met because they may have something else. You know, it is important. It's important to evaluate whether the care measures maintain or improve a patient's ability to interact and function within the environment. Uh, the patient is the source for evaluating the outcomes, you guys. And be sure to determine if the patients are following recommended therapies and meeting mutually set goals. That's why it's important to work with the patient together or their caregiver with them as well. If nursing, you got everybody has to be on board. If nursing care has been directed at improving or maintaining sensory acuity asking a patient to explain or demonstrate a newly learned self-care skill is an effective evaluative measure. So, if you're trying to make that whatever sense a little bit sharper, um, just their ability to show you or explain to you is a way for you to evaluate. And then ask the patient if nursing care successfully met their expectation. And if they say yes, you met uh, your goals. And this is the Hey Bear Sensory Celebration, and it's uplifting dancing for 14 minutes with funky beats for y'all so that y'all can read on y'all chapters because I know chapter 49 and maybe just kind of scan through it for 14 minutes, you guys, and laugh and just highlight some of the things that I told y'all was important. But this sensory celebration, you guys, it uses your senses of sight, hearing, and you may even, depending on how funky your speakers are, you might be able to feel the beat that's tactile. And then go get you a piece of fruit while you do it, you guys. Pause this, go get a piece of fruit, and then that can help your taste and your smell. So, all right. So here we go. This is approximately 13 minutes and 59 seconds. So 14 minutes of the bear uh, sensory celebration. It's just some funky music, and you can use this time, you guys, to highlight your book and do the things that um, you need to do. Okay, everybody. So that was your sensory lecture. Please do listen to this tape. You can play it in your car, and um, I would suggest even taking notes. Do it several times. Read your book. Outline a lot of the things that I said, highlighted, and good luck with this chapter on sensory. And have a good evening. Chapter 49. Thank you very much.